Hello, good evening to everyone. In this session, we'll do some recall of recent INICET exam. So, from the medicine point of view, paper was moderate. There was some few tricky questions, and some of them were new questions. So, let's discuss them one by one. Starting with the question number 1. So, question is, Carney complex include all of the following except. Options are atrial myxoma, nevi, Epstein abnormally, or endocrine abnormalities. So basically this complex consists of 4 criteria, and these criteria include the first criteria is the skin manifestation, that there can be skin lesions will be present on the face or on the neck. Endocrine tumors can be adrenocortical disorders. This is the most common endocrine abnormality of Carney complex. Cardiac myxomas are the most common myxomas which are present, and some non-endocrine tumors will be present. So these are the 4 criteria for Carney syndrome. And if 2 of them are present, this is diagnostic. So here the answer will be which is not present. Epstein anomaly is not present. It is atrial myxoma, which is a part of cardiac abnormality of Carney complex. Now coming to question number 2. So this topic, multiple endocrine neoplasia, is one of the very frequently asked questions from the endocrine section. After diabetes, it is the most frequently asked. So MEN2B syndrome, which of the following is present? All except. So the answer here will be MEN is now classified into 1, 2, 3 and 4. So these are in MEN1, which is also known as a Wermer syndrome. The most common abnormality will be of parathyroid tumors, pancreatic tumors and pituitary tumors. So it is a combination of triple P. 3 P's will be present here. While MEN2, which is also known as MEN2A, it is also known as Sippel syndrome, in which the most important is the medullary thyroid cancer and pheochromocytomas and parathyroid tumors, but most importantly is medullary thyroid cancer. While MEN3 is also known as MEN2B, and it consists of medullary thyroid cancers along with the pheochromocytoma. Means the first 2 feature will be the same as 2A, but characteristically it will have marfanoid habitus that will be present. Mucosal neuromas will be present, as well as the megacolon will be present. While MEN4 is equal to MEN1 plus other tumors. So these tumors of parathyroid, pituitary and pancreatic tumors will be present, same as MEN1. Along with that, there will be a tumor like gonadal, adrenal, renal or thyroid tumors will be present. So this is 4. So question is asking in MEN2A, which of the following is not present? So the answer here will be in MEN2A, the marfanoid habitus 2B, which is not present. So in MEN2B, the feature which is not present will be the parathyroid hyperplasia, that will not be present. So this is also known as MEN3. So this is not present in cases of men 2b or also known as men 3. The pheochromocytoma will not be present. Sorry, parathyroid tumor will not be present in MEN 2b. So answer here will be option number C. That will not be absent. Now coming to the question number 3. Question is a young female presents with palpitations, dizziness after playing a lawn tennis. She is having multiple such episodes for the past 2 years. Which of the following condition is most likely the cause? So here ECG is given, V1 ECG lead is given, and after the QRS complex we can see double slurring is present. This is typically epsilon wave. This is epsilon wave. So epsilon wave is highly characteristic of arrhythmogenic right ventricle dysplasia. While in HOCM, the characteristic feature will be LVH, left ventricle hypertrophy will be present. While in the Brugada syndrome, in the lead V1, we will see coved ST elevation like this. This is a coving. Coved ST elevation will be seen in Brugada syndrome. While Uhl anomaly is absence of right ventricle myocytes. They will be absent. They are not characteristically associated with these ECG changes. Question number 3, answer will be ARVD, that is arrhythmogenic right ventricle dysplasia. Now moving on to the next one. Next one is slightly high level question from the criteria. So they have just asked the criteria ki they are used in which condition. They have not asked the details ki what are the components of those criteria. So True Love and Witte criteria is used for the classification of acute severe ulcerative colitis. So based on these criteria, it is divided into mild, moderate and severe. So the parameter which are used here are the frequency of the defecation. This is the most important one. So if it is severe, 6 or more than 6 times will be there. Presence of blood in the stools if it is triple plus. Fever of more than 37.5 degrees Celsius. Tachycardia 90 or more than 90. Low hemoglobin and elevated ESR. So these are the other parameters which are taken in the criteria to define the severe ulcerative colitis. So maybe in the subsequent exams you might get a question ki there will be what are the parameters which are used in this criteria, in these two criteria. Means ki just remember the parameter which are used. Remember the parameter which are used, and if you can see GIT notes, in the GIT notes only one criteria is being mentioned ki stool frequency more than 6 was severe and less than 6 was mild to moderate ulcerative colitis. So know just the name and these parameters which are used here. Now come to question number 5. So question number 5 is which of the following virus spread predominantly by water? Predominantly by water means fecal-oral mode of transmission. So this is one of the easiest question which was asked. So the answer is hepatitis A virus, and if the option was HEV, then it will be a multiple correct response. So both these viruses are spread by water. Now moving on to question number 6. Question number 6 is which of the following can't be used to differentiate psoriatic arthritis from other form of the arthritis? So psoriatic arthritis from other arthritis means IBD associated arthritis or Whipple disease arthritis. How it can be differentiated. So psoriatic arthritis is characterized by dactylitis that can lead to a sausage type of digits can be present here. Enthesitis can be present, nail pitting can be present, while the presence of diarrhea is associated with Whipple's arthritis, Whipple's disease arthritis, and IBD arthritis, IBD associated arthritis. So psoriatic arthritis is not typically associated with diarrhea. So answer will be B option. Answer will be B option. Now, question number 7. Not effective in COVID-19. We can say prevention. So the question was COVID-19 prevention. So still COVID questions are being asked, but these are easy questions. Which has proved to be effective in the prevention? So we all know that it is the hygiene which is important, mask which are important, vaccine which is important. So these can prevent COVID-19, but ivermectin still not proved that it is effective for COVID-19. So answer is A option. All right, now coming to the value-based questions. So value-based question is GFR stage. So GFR stage 3B. So they have picked out of 3A and 3B, the 3B staging. So to know the staging, if it is a G1 stage, so the GFR will be more than equal to 90. For the G2 stage, it is 59 to, sorry, it will be 60 to 89. So 30 difference, this is G2. While G3 will be 30 to 60, but they have divided into G3A and G3B. So there will be a difference of 15. So it will be 45 to 59 and 30 to 44. So overall it will be 30 to 59, but 15 difference they have created here, while G4 is 15 to 29 and G5 is less than 15. So this is the classification of the CKD GFR stage. So the answer here will be B option. So unfortunately a value based question which you have to remember here. Now moving on to the question number 9. So question number 9 is high anion gap. So HAGMA is high anion gap acidosis. So high anion gap metabolic acidosis. So high anion gap metabolic acidosis is unmeasured anions are increased and unmeasured anions are lactic. So it will be lactic acidosis. It is acetic acid. So that is DKA, diabetes ketoacidosis. Lactic acidosis will be present. It can be presence of some toxins like methanol poisoning or ethylene glycol poisoning. So they all cause unmeasured anions. Methanol cause formate, ethylene glucose cause oxalate. So these are all the reasons for the high anion gap. Now the tricky question is out of acute renal failure and diarrhea. So when the acute renal failure GFR become less than 20, so what happens? The phosphate levels increase, and phosphate is unmeasured anion. Unmeasured anion. So that cause high anion gap acidosis. While if the renal failure where the GFR is more than 20, then it can be a non-anion gap metabolic acidosis also. So know this important. Know this important. Okay, sir, option were inborn error of metabolism. So inborn error of metabolism. Inborn error of metabolism. That can cause, if it is causing a renal failure, then it will lead to a high anion gap metabolic acidosis. While diarrhea for all practical purposes, it is a non-anion gap metabolic acidosis because of mainly bicarb loss in the diarrhea. Diarrhea does not cause high anion gap. So all of these can cause high anion gap except diarrhea. So even if it is inborn error, that will be high anion gap metabolic acidosis. Now coming to question number 10. So question number 10 is one of the easy question in the GIT. This we have discussed so many times. That intrinsic factor is released by the parietal cells of stomach. So if the stomach is removed, gastrectomy is done, and patient develop the signs of neuropathy, Romberg sign is positive, dementia is there, megaloblastic anemia is there, so answer will be B12 deficiency. It will be a B12 deficiency because of the loss of the intrinsic factor. Invariably it will lead to it. While folic acid deficiency does not occur in the gastrectomy, and zinc and thiamine deficiency does not cause these symptoms. Now come to question number 11. Alright, so this time from inflammatory bowel disease, at least two questions have come from the inflammatory bowel disease, and as I told you always, the last moment revision topic where the questions are asked is IBD. Whether it is pathology, whether it is surgery, medicine or pharma. So this is a question of pharma. So question is JAK inhibitor drug for Janus kinase inhibitor drug for moderate to severe ulcerative colitis who is not responding to TNF alpha antibodies is. So basically the inhibitor of JAK, what they lead to? They lead to the decreased production of cytokines, and they are immune modulators. So out of this, the drug which is used, so A option is ustekinumab. So this is a interleukin 12-23 block antibody. So what is the role of this antibody? This is used in IBD, and especially when it is associated with psoriasis. So then it has a best role. Then it will have a best role. Etanercept is a TNF alpha receptor antagonist. So the property is not the JAK inhibition. While C option is correct. So this drug is reserved for refractory cases who are not responding to the TNF alpha antibody. While vedolizumab is anti-integrin antibody. So the mechanism of action is different. So it inhibits the adhesion of the lymphocyte with the GIT blood vessels. So it is used for the resistant cases of the inflammatory bowel disease. So answer is C option. Now come to the next one. So next is most common genetic cause of the coagulopathy. So the most common genetic cause of coagulopathy is factor 5 mutation. This is a one-line question which you have to remember. 13. So question is, in Guillain-Barré syndrome, which is not true? So option number A is plasmapheresis is done only in refractory cases. IV immunoglobulin are the first line of drug. So the first line of the drug can be both. It can be IVIG, IV immunoglobulin, or it can be plasmapheresis. So plasmapheresis is mainly when there is a respiratory failure is happening. So we go for plasmapheresis. So both share the first line drugs. It is not that plasmapheresis will be given in the refractory cases. They can be given means as a first line agent. While areflexia of the weak limb is included in the criteria, true. This is true. Means it is a neuropathy, so there will be a loss of reflex. Albuminocytological dissociation of the CSF is present. That means ki albumin will be more in the CSF fluid, and cytology means cells will be almost near normal. So this is the meaning of albuminocytological dissociation. So proteins are more because it is autoimmune inflammatory disease. So that can be a positive finding in the CSF. Now let's ask me a question. So albuminocytological dissociation, can anyone tell me what are the other causes of it? Plasmapheresis is not indicated in refractory is the option. Yes, that is the option. So what is your question? Plasmapheresis is not indicated in refractory is the okay. So can anyone tell me what is the other cause of albuminocytological dissociation in the CSF fluid? Rather than being the recall, I'm asking you the question. Okay, anyone? Okay, so just tell me two important causes of aluminocytological dissociation. Now come to question number 14. Question is, which of the following is associated with sacroiliitis and uveitis? So sacroiliitis and uveitis is characteristically a combination of ankylosing spondylitis. The most common extra-articular manifestation of ankylosing spondylitis is uveitis, and almost 90% of the cases will have HLA-B27 positivity. So answer is D option here. Okay. Now question number 15. Though it is a biochemistry question, diabetes patient having elevated triglyceride and VLDL. Elevated triglyceride is the most common dyslipidemia of diabetes. Dyslipidemia. So normally what happens, insulin inhibits hormone sensitive lipase. So that is a property of the insulin. So if there is a insulin resistance, which is obvious in a diabetes patient, 60-year-old, most likely a type 2 diabetes patient. So what happens in insulin resistance, hormone sensitive lipase activity will increase. If this activity is increased, there will be more free fatty acids, and more free fatty acids, they will synthesize more triglycerides in the liver. So they will be spill into the circulation. So high triglyceride is due to high free fatty acids due to increased activity of hormone sensitive lipase. Also, because of the insulin resistance, there is a decreased lipoprotein lipase. So that will increase the VLDL levels. So the main biochemical defect is increased hormone sensitive lipase activity and a decreased lipoprotein lipase due to insulin resistance. Okay, now come to question number 16. So question is, in uncomplicated malaria, which drug is not used? So I think this is not a correct question, but if we have to choose the options, so in uncomplicated malaria, which drug is not used? So uncomplicated malaria is ki I will assume ki the malaria which is not due to falciparum, Plasmodium falciparum. So the agent which is used in Plasmodium falciparum out of this is sulfa pyrimethamine combination, while artesunate compounds are thimeter, chloroquine. Primaquine is radical cure for Vivex. So Plasmodium vivex and other species, you can use these agents, but not the sulfa pyrimethane that is used for Plasmodium falciparum. So that will be the most likely answer here. Now, coming to question number 17, which of the following is not included in a TTP, thrombotic thrombocytopenic purpura? So TTP is characterized by the diffuse thrombus in small vessels. So it is a small vessel thrombosis, not large vessels. Thrombocytopenia because of increased consumption of platelets, it will be positive. Microangiopathic hemolytic anemia, like it is a small vessel, there is a thrombus. So when RBC pass through this small area, it get fragmented. That is known as small vessel injury leading to hemolytic anemia. Renal failure, yes, renal failure is seen in TTP because it can also affect the small vessels of kidney. So answer here will be A option. Rest of these will be seen, and other feature will be fever, while indeed the most common presentation of TTP is CNS, neurological abnormality, that is altered sensorium. Question number 18, which of the following statement about the Behçet's disease is incorrect? So pathology test is done under the or included in the International Society Group criteria for Behçet's disease. Yes, this is true. Pathology test is included as the criteria. Intestinal manifestations resemble those of Crohn's disease. These are the direct lines from Harrison. So they have picked direct line. Means ki both the diseases resemble each other. Only difference is extra intestinal manifestation, like the involvement is ileocecal involvement is there, ulcerations will be there, while oral and genital ulcers occur on the dorsal aspect of the penis. No, it is scrotum. The ulcers are present. It is associated with higher risk of thrombosis. Yes, both superficial thrombophlebitis as well as the deep vein thrombosis can be present. So the answer here will be incorrect is C option. Incorrect is C option. Okay, large vessel not given in thrombosis. So what was given? So you can just recall back the correct option. What was the option? A option, so that we can rule out, because these three are true. No doubt, B, C and D are absolutely true statement. So you can just recall, and so that we can correct this option. Yes. Now come to question number 19. So question number 19 is, I would say this is slightly a tough question. Means it's lots of fact for autoimmune polyglandular syndrome type 1. So mucocutaneous candidiasis onset in the infancy, type 1 diabetes is associated with it, or hyperparathyroidism. So there are autoimmune polyglandular syndrome 1 and 2. So these are associated with multiple endocrine abnormalities and non-endocrine abnormalities. So these are the difference between these two. And also this is early age onset and this is late age onset. Which is age-wise difference which is given here, and instead of the hyperparathyroidism, so it is the hypoparathyroidism which will be present here. So answer is hypoparathyroidism will be seen rather than hyperparathyroidism. So again, a fact-based thing, unexpected question ki they will ask from this table of the Harrison. Now come to question number 20. Which of the following statement about the celiac disease is incorrect? Yes, celiac sprue is one of the condition which is again a favorite topic of the examiner in AIMS or INICET. Now they are asking the same topic but with more depth. So they are going into the more depth of these topics now. So anti-IgA TTG is the key diagnostic marker. Yes, this is one of the screening test which is done, or a screening antibody which is done. Modified March criteria is used for histological classification. Yes, this is true, but no need to remember those criteria. Anti-gliadin antibody are relatively specific for celiac disease, especially if patient is IgA deficient. Indeed, this point, if some of you have attended the predictor series of INICET, so this point was discussed in those questions of celiac sprue. Celiac sprue topic was discussed in the predictor series, and this antibody was also discussed. What is the role of this antibody, especially if the patient is IgA deficient. While the genetic markers are HLA, DQ2 and DQ8. These are the genetic markers, so answer will be D option. So this is incorrect statement here. Question number 21, vaccine which is not required for a patient of after the age of 65 years of age. Hepatitis B, yes, this is required, especially if comorbid conditions are there, if diabetes is there, so it is recommended. Varicella zoster, yes, true. Papilloma virus vaccine is not recommended. Influenza virus, pneumococcal virus vaccine, pneumococcal vaccine, these are all recommended vaccine after the age of 65 years, not HPV vaccine. So C is the correct answer here. Okay, so now come to question number 22, and if there is any correction in the options, you can let me know. Patient has a blood pressure of 220 by 130 or 220 by 120 and a feature of stroke. Which of the following should not be done in this patient? Checking the blood pressure multiple times before administering antihypertensive, yes. Regular monitoring of the blood pressure is needed. This is true. While the D option is avoid rapid reduction in the BP during the antihypertensive medication, because it will decrease cerebral perfusion. This is also true. So it should not be rapidly reduced to a very low level. Now B and C option. Reduce the systolic BP to less than 140 in intracranial hemorrhage, or reduce the BP to systolic BP to less than 160 before acute reperfusion therapy in ischemic stroke. So out of which the correct response which is asked here is BP reduction to less than 140. This seems to be a true statement, while instead of 160 this should be less than 180, not 160. So based on these values, I will pick C as the correct option here. Come to question number 23. Question is, you are drawing blood sample for serum calcium. Which of the following is avoided to prevent false reporting of the calcium values? So collection of in the sodium citrate. So citrate binds with calcium, so it will cause false low calcium values, so it should be avoided. Now forearm exercise and fist clenching, so what that lead to, that increases the potassium values and that increases the lactic acid values, and they will interfere with the calcium measurement, so they can also lead to a falsely low calcium, so they interfere with it. While prolonged immobilization of the patient acutely does not affect, but chronically it can lead to bone resorption. Bone resorption can be there, and when there is a bone resorption, there can be high calcium levels, but that is in prolonged immobilization patients. So the best answer should be A and B, but no A and B option is written here, so we have to pick the C option also, because A, B is not given here, so A, B, C will be the choice, obvious choice. Rapid removal of the tourniquet should be done, so it should be done, because prolonged tourniquet will cause high potassium values. It will compress the muscles. From the muscles, potassium will be released, and that will interfere with the calcium assays. So the D option is true. That should be done. That should be done. So all the things which should be avoided, A and B should be avoided. But by default, we have to pick the C also here. Now come to question number 24. So I think this question must be discussed in radiology also. HRCT shows a tree in bud appearance with the consolidation and the effusion. A low level of the ADA is there, and if the low level of the ADA is there, TB is ruled out. Tuberculosis is ruled out. Lymphocytic predominance. So tree and bud appearance can be because of bronchiectasis, can be because of pneumocystis, can be pneumocystis is also fungus, so or can be a typical fungus. So answer here will be fungal hyphae surrounded by the lymphocytes. That will be the best answer here. This is a fungal infection most likely. Now question number 25. Which among the following is the first investigation recommended for diagnosing the pheochromocytoma? So they are asking about the screening test. So the screening test for the pheochromocytoma should be a sensitive test. Out of these, the sensitive test is urinary level of total metanephrin. It will be the most important sensitive test. Specific test will be the DOPA PET CT scan or MRI will be done. Question 26. Which of the following suggests a glomerular cause of the hematuria? Glomerular hematuria. So glomerular hematuria is diagnosed by these features. There should be a RBC cast, but that is an investigation. It can be dysmorphic RBCs. And usually the proteinuria value of more than equal to 2 grams per day. These are the features. While glomerular hematuria can cause a dark colored urine, and which is typically described as a cola colored urine. So this is glomerular hematuria, cola colored urine, because of the RBC cast and dysmorphic RBCs. So best answer here should be a B option. Now edema is rare. So if it is a glomerular hematuria, there can be a low GFR. Low GFR can cause water retention. So it can be present or it can be absent. So we have to include A option by default. While crystalluria present and dysuria, they are not suggestive of glomerular hematuria. So best answer here should be B option. If B option is not there, then you have to pick B plus A option. Edema is rare. So these are the medicine questions. So as we have seen, 2-3 questions were there which needs fact based things like polyglandular, autoimmune polyglandular syndromes, and the criteria's values of GFR. These were asked. But overall, if we can see, it was a question which have common diseases, and it was a moderately tough paper. So all the very best for your results, and if you have any doubts, any questions, you can put in the comment section. Thank you.